Good evening, everyone. Warm welcome to the fourth day of Oral Cancer E Conclave organized by ICanCaRe Sterling Cancer Hospital and FHNO, Foundation for Head and Neck Oncology. We are on the fourth day. In the last three sessions, we have had prolific discussions about challenges of diagnosing an oral lesion, about the early oral cancers, about locally advanced cancers. We saw about the treatment. We saw how beautifully the panel discussion gave solutions to very challenging cases. And here we are today on the fourth session where we're going to discuss and talk about the rehabilitation and follow-up of the oral cancer patients.
Thank you, Dr. Biswas. So this was indeed very short and crisp. So moving on to our next session and requesting Dr. Satyajit Naik to chair this session. Dr. Satyajit is the principal of Institute of Dental Sciences, Bareilly. And the speaker for this session is Dr. Rakesh Rawal, who is Professor Life Sciences, Gujarat University. So over to Dr. Rakesh and Dr. Satyajit.
Dr. Meenu, unfortunately for us today, Dr. Rakesh is down with COVID and he's isolated in. So if Dr. Naik permits, then I would like to take on that session and give a quick insight into that, if I'm permitted to.
Sure, ma'am. I think Dr. Satyajit has also not been able to join us because of some problems.
So Dr. Reena, we will request you to kindly please take on this session.
Thank you so much, Dr. Walia. I'm sorry. I only hope people are not bored with my voice today. So it's just that, we are here and we are talking about as to why are we got to have specialists in this. And we had a very passionate session by Dr. Pavan himself. And we all know that we are all here today. All of us for the last 1 month have been spending every Sunday of ours here together because we have one big agenda in our hands, because we know that an oral cancer has multiple etiologies and is primarily linked to health-related behaviors that we all know. And the incidence of oral cancer can primarily be reduced through health education and preventive healthcare in the public. So that's one thing we all are aware of. And we know that one of the primary causes is tobacco, which is the biggest public health hazard. And tobacco is the leading cause of death. It kills more than half of users. There is no such product which one buys and dies, eats it and dies, consumes it and dies. So, and it's 7 million deaths directly because of tobacco users and 1.2 million deaths of secondhand users. So this is like secondhand smoke. So we have such a huge problem that is standing around here, and in 20 million per year are drawn to this tobacco use. So there is, and we know from the GATT survey that there is a large percent of people in the urban as well as the rural segment which have actually tried to reach out and tried to quit tobacco, but many of them have succeeded, but most have not. Many of them did manage to get some amount of help from healthcare professionals, but most of them did not. So why did they not? So the assessment has shown that there is a huge skill gap. The skill gap is so big that it needs to be really, something needs to be done by all of us. Something needs to be done. We need to have, is there somebody else who wants to say something? Okay, I think that's okay. So basically, we are looking at oral cancer, but we as a community of healthcare professionals have a bigger goal in our hand. So we have the Sustainable Developmental Goals, SDG goals, on which we have target 3A. And 3A is all about our tobacco. And when we look at tobacco, tobacco is not just about oral cancers, which is a month that we are talking about, which all of us here today are concerned, but it is also one of the most important modifiable risk factors for 5 of the NCDs, 5 of the non-communicable diseases that we have around. So is it not important for us that we actually look at tobacco cessation as a specialization and as something that we really need to create manpower into this? So tobacco cessation, because this tobacco addiction is not a simple thing. It is not just a habit. It is a disease. It is very well established as a disease because this tobacco addiction involves an interplay. There's an interplay of pharmacology, learned and conditioned factors, genetics, social, age, environmental factors, and there is a huge nurture versus nature debate which is always on. And this particular drug, tobacco, nicotine, is a mood depressor, mood elevator, and it acts on these nicotinic cholinergic receptors. Also, that we know that the smoking behavior, or rather, I should not use the word smoking, the nicotine use behavior is. Thank you. Is influenced by pharmacological feedback, environmental factors. So there is three things, as we heard, A, B, C, D is involved, and this doesn't happen just one cannot be, and there is no cookbook approach to it. There is no cookbook approach because what one person requires will be very different from the other. The dependence value of one person, the willpower index of that person, and the social or the pharmacological or the physical aspect or the social aspect or the psychological overplay, which one is dominant will have to be assessed. That would require time, that would require a commitment, that would require a motivation, both from the patient, the families, and most importantly from you and me, who are tobacco intervention specialists. So this gap needs to be filled. So why tobacco cessation as a specialization? I think we all are unanimously in agreement with it because we have this as a huge common enemy, a modifiable risk factor for 5 NCDs, oral cancers, one of the biggest problem of the head and neck cancers, where we are with this particular drug, if we can get rid of it, and if we really can manage to, talk to patients intelligently, get a group of people, so not just specialists, but we need volunteers, we need marshals, we need ambassadors, we need people at all levels in society, basically to help the society at large, causing an awareness, along with that building that group in between, which is actually going to move that patient from the society to the tobacco cessation specialist. Because why is it that a person who uses tobacco and knows that he's going to die one day and he's also killing his family members and his surroundings is not quitting? I'm sure he wants to quit. We all know they quit. They try to quit, but they fail to quit because there isn't a proper protocol which they are aware of. So that is where it comes in. That is a 360-degree care with a 92% success rate, with a digital empowerment which is happening for the patient as well as for the doctor, a protocol which is well managed, which I'm proud to say that ICanCaRe has, with pride rather, I say it, that we at ICanCaRe have, and the need to train specialists is there. So I think, ladies and gentlemen, and my professional brothers and sisters, we need to all join hands together, make this really strong, build ourselves and build the society around us to become so strong to take on this at all levels, be it volunteers, be it marshals, be it ambassadors, and most importantly, all of us to become tobacco intervention cessation specialists. Thank you so very much. Thank you, Dr. Meenu.
Thank you, Dr. Reena. As always, very aptly said. And I definitely agree with you. There's no cookbook approach. Each and every patient we see day in and day out, each and every person is different. And the approach also has to be individualized.
Absolutely, Dr. Meenu. So hence, as a result, what at ICanCaRe we have. So we are inviting doctors because we have been very fortunate to have been given a Global Foundation Fund grant for educating, because you see, it has been well understood by the world at large that there is a skill gap, and this skill gap needs to be filled in. And our program of ICanCaRe is a certified program, probably the only one in the country. I'd be happy to state that, and proudly on an open platform, that we are a university affiliated and an accredited certified program. So this has been accepted by this foundation, and we have got, we have been asking to invite now doctors, that is cardiologists, pulmonologists, dental surgeons, and the role of dental surgeons is so primary in this because they really can change the entire progression of the disease, because if their early diagnosis and early management is done in a dental clinic, and probably quick and referrals to our our specialists in the other fields that we have, the oncosurgeons who come in with us. So we have 100% scholarships, and this is a certification in the tobacco cessation program, and it is an online training program. So it doesn't, everybody can sit in the comfort of their homes. It is conducted on a Saturday evening between 6 and 8 over 4 weeks. So we have 100 seats available. And so we are still now open for the month of May, June, and July. So we really want you to come and register. And the numbers are all given. It's completely free. So we just want everybody who's from the heart to come in and get certified as one of our specialists. Thank you, Dr. Walia, for your time.
Once again, thanks, Dr. Reena. And I think everybody will like to take this opportunity. And it's a wonderful opportunity. And just 4 weekends and 2 hours each every weekend probably will go a very long way to help our community.